The first 72 hours after an acute back pain episode are more clinically significant than most people realize. The decisions made in that window meaningfully affect both the intensity of the acute phase and the probability of developing chronic pain. Here is the evidence-based approach to those first 3 days, covering what to do, what to avoid, and the specific symptoms that change what the correct response is entirely. In the first 12 hours, the priority is reducing the acute inflammatory and muscle spasm response while maintaining as much normal movement as possible. Cold application, an ice pack or frozen piece wrapped in a thin cloth for 15 to 20 minutes every 2 to 3 hours reduces acute local inflammation and provide analgesic effect through the gate control mechanism at the spinal level. Heat is appropriate once the acute inflammatory phase has passed, typically between 24 and 48 hours. In the first day, applying heat can increase local blood flow and amplify the inflammatory response, the opposite of what you need in the acute phase. Over-the-counter analgesia is appropriate and sensible. Paracetamol at full therapeutic dosing provides meaningful analgesia with a strong safety profile. Ibuprofen adds anti-inflammatory benefit that is most relevant in the first 48 hours when the inflammatory process is most active. Both can be used simultaneously at standard doses in people without contraindications. Positions of relative comfort reduce muscle guarding. Lying supine with knees bent and feet flat reduces lumbar compressive load. Side lying with a pillow between the knees maintains neutral pelvic alignment and takes tension off the lower back musculature. A bolster, rolled towel, or spare pillow placed under the knees in supine is particularly useful in the acute phase. It offloads the psoas muscle, which attaches directly to the lumbar vertebrae and whose spasm contributes significantly to acute lower back pain. Both are preferable to lying completely flat, which increases posterior lumbar loading. The most important behavioral instruction is this: take short walks every 1 to 2 hours from the first day, even when they are slow and uncomfortable. Not exercise sessions, not physiotherapy routines, just 5 to 10 minutes of gentle walking repeatedly throughout the day to maintain spinal movement and prevent the rapid deconditioning of the deep stabilizing muscles that begins within 24 hours of inactivity. The deep lumbar stabilizers, multifidus and transverse abdominis, begin losing tonic activation efficiency within the first day of rest, and rebuilding that activation once lost takes substantially longer than maintaining it. The physiological case for movement is now unambiguous. Voluntary movement within pain tolerance accelerates healing, and forced rest beyond 24 hours worsens outcomes. Landmark studies comparing bed rest versus continued normal activity for acute lower back pain across thousands of patients found that continued activity produced faster recovery and significantly lower rates of chronic pain development in every well-designed comparison. What not to do in the first 72 hours. Do not take extended work absence beyond what the pain genuinely requires. The research linking work absence beyond 2 weeks to chronic back pain development is consistent across multiple large studies and health systems. Do not apply heat continuously in the first day. Do not interpret acute back pain as evidence of serious structural damage that requires complete stillness. For the overwhelming majority of presentations, the acute pain response is a protective alarm rather than a reliable structural damage indicator. Progressing from lying to sitting to standing to short walks is the natural load gradient for the first few days. Each position adds incrementally more load to the spinal structures, and moving through them systematically reintroduces load at the rate the healing tissue can comfortably tolerate. By days 2 and 3, begin specific exercises within your pain tolerance. Gentle knee to chest movements in supine, pelvic tilts, and a modified cat-cow which moves the spine through its full available range without vertical loading, and is one of the most appropriate early exercises for acute lower back pain. These are red flags requiring same-day medical assessment. For acute back pain without those features, which is the vast majority of episodes, following this framework gives the healing process its best start and meaningfully reduces the risk of the episode becoming chronic. The link in the description covers the complete back pain management approach, including when to add physiotherapy and what it involves.